Thank you for the opportunity to speak today. My name is Steven Schuler. I'm a professor of psychology and informatics at the University of California, Irvine, a licensed clinical psychologist, and a mental health services researcher. Over the last 20 years, I've developed, evaluated, and deployed technology to support people's mental health and well-being. I do want to disclose that I serve on the Scientific Advisory Board for Headspace, for which I received compensation, and received consulting payments from Boehringer Ingelheim and Otsuka Pharmaceuticals. I'm speaking today, however, in my role as the president of the Society for Digital Mental Health, a nonprofit organization with membership from researchers, healthcare systems, payers, digital mental health companies, and patient advocates. We are dedicated to advancing the safe, effective use of digital mental health treatments, ensuring accessibility to all in need. First, I want to commend the committee and the FDA for convening this important discussion on the role of generative artificial intelligence in digital mental health devices. The speed of innovation in the space is extraordinary, and we recognize both the tremendous promise and the critical responsibility that come with deploying generative AI technologies and the service of supporting those with mental health disorders. Too many people who experience mental health disorders fail to receive treatment, and even those who do often don't fully benefit. We need effective, safe, and scalable interventions that meet the needs and interests of consumers and providers. Generative AI can play an important role here, but we need responsible innovation that centers consumers and their interests. Society for Digital Mental Health will encourage the committee to focus on three key principles: transparency, safety, and clinical accountability. We also recommend that FDA consider a risk-based framework specific to generative AI devices, building upon existing software as a medical device and digital health policies. This framework should recognize the unique characteristics of generative models, such as their ability to evolve after deployment. Yet we believe clear processes can be provided for model updates, revalidation, and performance monitoring. Now I'd like to turn this over to one of our members, Aubrey Schick, to provide more context regarding the principles mentioned.
Thank you, Stephen, and thank you to the committee. To advance these key principles of transparency, safety, and clinical accountability, we look to FDA's existing frameworks. The goal is to help people know when to use generative AI mental health tools and how to use them safely and effectively. Transparency must be human-centered. FDA's Transparency for Machine Learning-Enabled Devices Guiding Principles frames transparency needs in terms of who, why, what, where, when, and how. This document clarifies that transparency needs live across the user interface, which FDA defines to include labeling, training, physical controls, display elements, packaging, notifications, not just labeling alone. The goal is to have plain language information embedded throughout the experience so that people have the right information at the moment of decision. Safety can be proportionate to risk. Generative AI offers benefits and expands access, but also has risk, which include biased data, overgeneralized outputs, and unverified claims. Mitigations for this include clinical validation, appropriate human oversight, and post-market surveillance to ensure reliability across settings and diverse populations. It's important to keep oversight risk-aligned, including for lower-risk products that may be outside of FDA's device oversight. General wellness and enforcement discretion tools enabled by generative AI can provide transparency proportional to risk. A great model for this is FDA's enforcement policy for digital health devices for treating psychiatric disorders that was in place during the COVID-19 public health emergency. This guidance provided transparent labeling recommendations that enabled access and innovation while clarifying limitations and risks of products. This could be appropriate to consider it for generative AI-enabled digital mental health technologies. Under this policy, there were no significant adverse events reported, and it kept transparency and safety front and center while expanding innovation and access. Clinical accountability requires transparency and shared responsibility. For all generative AI-enabled digital mental health technologies, both regulated devices and those outside of current oversight, accountability begins with a clear intended use and the intended role of AI in care. Generative AI should augment, not replace, the clinician-patient relationship. Devices must state and honor a defined scope of practice. With this clarity, stakeholders can meet their obligations across the product lifecycle, including post-market monitoring. This can be done by providing clear, plain language information in the user interface, affirming the intended use, including AI's role, performance capabilities, limitations, and decision processes, in hand with ongoing performance information, tracking real-world effectiveness, unintended consequences, and patient-reported outcomes. This, as well as transparent safety first updates when generative AI features change, explaining what changed and why, while prioritizing patient safety and transparent and ethical oversight. In summary, we respectfully ask the committee to consider recommendation toward human-centered transparency, risk-aligned oversight, and clinical accountability with shared responsibility. Americans want to use these technologies, help them do so safely and effectively by setting a clear expectation of transparency compliance. In closing, SDMH supports thoughtful Gen AI integration guided by transparency, clinical rigor, and ethical responsibility. We appreciate the committee's leadership in shaping the next generation of digital therapeutics and patient care. Thank you for the opportunity to share our perspective.